Thanks for joining me today. Today we're going to be looking at risk minimisation and risk benefit training. First off, I would like to explain the why. It is essential that we minimise risk as best as possible when providing experiences, resources or environments to children. We as educators are constantly risk managing in our heads. When something is of a higher risk, then a formal process must follow. So if we're having a look at the national regulations, the only regulation it does state is that we need to have a risk assessment conducted for an excursion, but it is also our duty of care and the law that we keep children protected at all times. The National Quality Framework, Element 2.2.1, implementing risk minimisation plans for children enrolled at the service who have specific healthcare needs, allergies or relevant medical conditions. Element 2.2.1, evidence of planning for excursions that includes a written risk assessment undertaken prior to conducting an excursion and provided to families prior to conducting the excursion, and that supervision implications were considered. That's the why. So what we'll be looking at today is an example of a risk assessment. Risk assessments are sometimes called risk minimisation plans as well. It's really important that we don't just look at the risk, but we have a look at the benefit of the risk as well. So we'll be having a look at an example of that a bit later. Our template Kids Capers is formatted with the risk assessment details, the date, the type of risk and conducted by. If it is an excursion risk assessment, departure time and arrival times, proposed activities, water hazards, method of transport including proposed route, name of the excursion coordinator, contact details, number of children attending the excursion, number of educators and volunteers, and the educator to child ratio. We also then look at the risk benefit, so the activity, the reason for the activity, the link to outcomes, link to national quality standards. Then we identify the hazard. We look at the risks associated with that hazard. We assess that then against the risk matrix. Then we go through the control measures of the risk, who will conduct that risk, when this will occur, who the plan is prepared by, prepared in consultation with, who it's communicated to, and then any other information. And then always on the last page, we have the risk matrix. So today we're going to be having a look at an example of an excursion risk assessment and risk benefit. But we're looking at this because there is a lot of detail in this example, but there is other types of risk assessments as well as risk minimisation plans. So any child that does have a dietary requirement, an allergy or medical condition should have a risk minimisation plan. So we know as a centre and as an organisation what we're doing to minimise that risk. As well as if we've got higher risk activities or resources within our rooms or in our environments that children are accessing, it is also important that we have a risk assessment or risk minimisation plan. As well as an organisation, if we have higher risk activities like our children's Christmas party when we are out in the public, that we have a risk minimisation plan to ensure that we are protecting children at all times. So first off, we're going to have a look at the first page. We're going to have a look at the information that's there. So first off, we've got our date, our risk assessment conducted by, the excursion destinations along with their address, the departure times and arrival times. So lots of information through there, and the proposed activities that the children will be partaking in at that time. Also, we need to identify whether there's a water hazard. If there is, then we identify how we're going to minimise that risk and how the children are going to have access to that water. Next off, we've got our method of transport, and you can see on this example that we've got specifics. So a 57-seater bus, because it's important that we're letting the families know what specific transport that we're taking. The name of the excursion coordinator, the contact phone numbers, so the contact phone number of the centre, but also the contact phone number of the person that's responsible on the excursion, the number of the children attending, the number of educators and parent family volunteers. So we've got all our educators and as well as what we're expecting for our family volunteers for that excursion to go ahead. Also then we've got the educator to child ratio, including whether this excursion warrants a high ratio. So in regards to ratios for excursion, that is up to the centre manager and the support manager's decision. So for this one, we've gone to a 1:4 ratio because of the higher risk of that excursion. We've got a bit of a checklist to ensure that we know what we need to take and what needs to be done before. So first we've got our first aid kit, list of children for the excursion, contact information for the child, medical information for each child, list of adults participating, contact information for each child and each adult, mobile phone, and other items if need be. So the medical information, so if we had a child that had emergency medication like a puffer or an EpiPen, we would take that with us along with their action plan. Then we need to outline the benefit, because if we're taking this risk, we need to outline why we're taking this risk, and it's really important that we do this in this document. So we have a look at our activities that we're taking in, our reason for our activities, so, and then linking it to the outcomes. So that could be the Early Years Learning Framework or the National Quality Framework or the QKLG. This is when we start to really reflect on those hazards and what we're going to do to protect those children. So as explained earlier, we've got identify the hazard, identify the risk associated with the hazard against the risk matrix, which we'll have a look at a bit later how you determine that. But you can see through here it says likelihood, which is possible, consequence, which is moderate, and then that's what it equals. And we'll have a look at that matrix a little bit later. Then we need to outline how we're going to minimise this risk from happening, okay? Who's going to be responsible for that and when is it going to happen as well? So have a quick look at what we've identified in this risk assessment for this specific excursion. We're going to move on to the next page now so you can have a look at what else we've identified. So you can see we've got water, debris, children walking off, children becoming ill, toileting, behaviours. Some of those things that you might not even think of. Two indicators that some educators don't even think of is toileting. And it's really important that we understand as educators on an excursion, we're the ones that are responsible. Have a look over those. I'm going to go to the next page. The public. You might think on an excursion, what's the public got to do with it? But we don't know what we're exposing our children to. So it's very important that educators and volunteers are aware that the public can become a hazard for children. Then on the next page, we've got who the plan is prepared by, who it's in consultation with. So normally this would be someone in the leadership team just to be able to guide you and give you advice. Then it's who it's communicated to. So generally on an excursion, it's definitely communicated to all educators, and you would outline that on the back page and get them to sign that they understand that, as well as it's really important that we're communicating that to our family volunteers and getting them to sign there. If we've got any other information that we want to give, and just remember this is painting a clear picture to those people that are reading this risk assessment and needing to follow it. So on the next page, we've got a clear map of the route that we're going to be taking to the excursion and the way back as well. So that shows the route that we're taking and what direction that we'll be going in. On the next page, we've got our matrix. This is what we were talking about before. So this matrix lets us determine what type of risk we will be taking on each of those activities and each of those elements of the risk assessment. So we've got our likelihood, which could be rare, unlikely, possible, likely, almost certain. And then we've got our consequence, which is insignificant, minor, moderate, major, and catastrophic. Okay, so what we want to do is go, okay, so public, is the public going to be of risk to the children? Well, it is possible. So we come over here, and then if the public is going to be a risk, Yeah, looking at the consequence, what could the consequence be? So it could be moderate. So we go over here. So our likelihood would be possible, our consequence would be moderate, and then that equals high. So we are still in that high risk category. And it's important that we identify that through our risk assessment as well. So today we've had a look at an example of a risk assessment for an excursion, but as we explained earlier, it's really important that our environments are safe for children, and that if we are providing higher risk experiences or resources to children, which is what we want to do because so many children benefit and develop through taking risk and taking controlled risk, then a risk assessment should follow. We're going to finish up on activities. So you should have an activity sheet, which is the risk assessment that we've already had a look at in this training. What I have done is I have blanked out some of the areas of that risk assessment. I would like you to reflect on that risk assessment and fill in the blanks. Once done, please ensure that your name's at the top of the sheet and that you've handed it back to your centre manager. Thank you for taking part in this training.